Hello, my name is Marshall Thomas, and I'm here to talk to you about CPR and first aid. This is just an overview or a refresher, no certification involved. I'm a former firefighter, and I've been doing CPR first aid related things for about 30 years now. So let's get into it. The reason that you probably are here listening to this is because you're interested in making sure that you are able to keep your children and your family safe and to be able to deal with a major emergency. Well, uh, you really need to go get a certification in CPR first aid and go through the full class, but let's go over some of the basics. The first thing is that it's going to happen that you're going to need to use these skills when it's the absolute worst time, right? You're going to be worried about your kid, they're hurt, and you're going to say, oh, I don't know what to do. You do know what to do after this, and taking that class, you will know what to do, and that is this. The first thing you want to do is you're going to come across a scene, and there's going to be, let's say an adult. We'll go with an adult. Start off with on the ground, and you don't know how they got there. You just know that they're hurt because they're not moving and they don't appear to be breathing. The first thing you need to do is make sure that the scene is safe. And what that means is that there isn't anything around there that's going to hurt you as the rescuer. That is the key thing that you need to look at every time. First thing you come up upon a problem, make sure that the area is safe for you to be working in. This is important because let's just say that you've come across someone who is lying on the ground, non-responsive, and you know you know the area, you know the situation. They shouldn't be there, and it's not. This is an extremely unusual scenario. Well, you just walk up and touch them, and then you get electrocuted because you didn't pay attention to the fact that there was a wire on the ground leading to a puddle that their feet were in. That's why you need to make sure that the scene is safe before you enter in to render aid. Now, let's assume that the scene is safe. You've come across someone who's lying on the ground. You try to rouse them. You shake a shoulder and say, "Are you okay? Can you hear me? Are you okay? Do you need help?" That last part is key. Do you need help? You need to ask that because if they are in fact lucid, they get to make the choice as to whether you help them or not. Now, if they are not awake, they're not conscious, the assumption is that yes, they are going to want your help and it's okay to render that aid. So, you've shaken them. You may do a sternal rub right here if they're really unresponsive and they don't react. So now you determine whether they're breathing or not. Look and listen. If they're not breathing, then you would put them on their back and then you would start chest compressions. Now, those of you who have had CPR first aid before are probably saying, "Well, wait a minute. You haven't checked the airway. You haven't checked pulse," and that's accurate. But the protocols have changed over the years. So for lay rescuers, people who are not nurses or EMTs, paramedics, doctors, what we're going to do is we've determined that they're not breathing. Let's start getting some chest compressions going because there's still oxygen in their blood. And we need to get that blood moving so that we can continue getting oxygen into the brain. And that's key, so we're going to come back on that point in a minute. So what you do is you get them on their back and on a solid surface that isn't going to give underneath them. And you're going to draw an imaginary line along the nipple line, and then you're going to put your two fingers there, and you're going to start just below those two fingers, and that's where you're going to place the palm of your dominant hand. I'm a right-handed person, so my right hand would be there. And you're going to interlace your fingers on top of your non-dominant hand, on top of that one. And you're going to put your wrist right here, the palm of your hand rather, directly on top of the sternum at that two-finger mark. And then you're going to lock that dominant arm, lock the non-dominant arm above it, and then you're going to compress downward, get your shoulders up above, right up in line, and compress that chest. And you, on an adult or a large child, you want to get that chest compression down about 2 inches. It takes a bit of force to do that. And you're going to do those compressions 30 times. And then you would give 2 rescue breaths. Rescue breath is very simple. You're going to make a seal in your mouth and their mouth. and you're going to hold the nose closed so the air doesn't come back out at you. Blow into their mouth. That should fill their lungs. You'll see their chest rise and fall, rise and fall. So 2 breaths, and then go back and do 30 more compressions. So it's a 30 and 2 compression ratio. All right, or breath to compression ratio, compression to breath ratio. Sorry. Now, that 30 and 2, you're looking to get 100 compressions per minute. 100 compressions per minute. That is the compression ratio, that's the number of compressions that you need for an adult, a large child, or an infant. All three, 100 compressions per minute. And the breath ratio is the same for an adult, child, and an infant. It is a 30 to 2 ratio. And again, those of you who have been around for a long time and have had the older standards, yes, there were different ratios depending on the age of the victim. That's all been washed down to just this to make it simple. So if you can remember to do 100 compressions per minute and a 30 to 2 ratio of compressions to breaths, good to go. And that's easy. Now, I'm going to make it even easier for you. Let's say that you're not comfortable because of the blood or body fluids and not having a CPR mask. You're not comfortable doing the rescue breaths, or there's some other obstruction there that just is not going to allow you to do rescue breaths. The only thing you need to do is compressions. Do the compressions at 100 per minute. You may still want to do a 30 rest 30 cycle so that you can continue as a rescuer going, and that would work. Now, I missed a major step, and I apologize for that. Let's go back a step. You have determined that the scene is safe. You've determined that compressions are necessary. CPR needs to be started. Call 911, or have someone right nearby that you can see actually make the call. Call 911, because you need to have the professional rescuers on their way to take over for you. The reason that came to mind is because if you were going to be doing compressions, you can only do that for so long before you are going to be completely wiped out. It takes a lot of energy to do those compressions for time. Now, on an adult, we said that it's nipple line and then 2 fingers, and then you place your palm of your dominant hand at that point, just below that point. For a child, a large child, it's the same thing. For a smaller child, it's going to be just same placement, but instead of putting your second hand on top, you're just going to use the one arm to do your compressions, and that should give you about 1 inch of compression depth, and that's all you need for a small child. For an infant, you'll find that same line, and on that line, maintaining your 2 fingers, you'll take the infant and lay them across your arm. I don't have a demonstration doll with me, but just you have your child here with their legs dangling here, arms here, okay, their head cradled in your hand, and you'll be able to do the compressions this way. Now, this arm would be on the ground, or you'd have them on the ground, but that would be how you'd be able to just kind of imagine how they're laid out. And you want to be able to do the compressions so that you're compressing their chest and you're able to get that depth, okay? For an infant, you're going to go by feel, all right, just by feel. You want to make sure that you're actually getting the compression in, because what you're trying to do is get the sternum to compress against the heart, which is then going to compress against the back of the chest wall, and that's going to allow the heart to pump and profuse the blood through the body, specifically into the brain, to get that oxygen in there, okay? And again, it's 30 and 2 or 100 compressions a minute, and just the compressions, okay? So that's your CPR portion of the refresher. The other things that you're going to come across more often are choking, especially with children and older adults. You get choking incidents. So if somebody's choking, the universal sign for choking is this, and they're not able to speak. Again, let's go back to scene safety. First things first, is it safe to approach? All right. Second thing, once you determine that it's safe to approach, is asking them if they're okay. And if they're doing this and they're looking at you, that's a no. Okay, great. Can I help you? You've got a yes, and now you've got permission. If they say no, you cannot legally and ethically help them at that point. Right? Now, if they pass out, now their consent is assumed and you can help. We'll get to that in just a minute. So you'd be doing the Heimlich maneuver, and this is a way to clear that obstruction. The Heimlich maneuver is performed by getting behind the individual, putting your arms around them. You're going to take this fist, your dominant hand, make a fist. You're going to take your non-dominant hand and put it behind that fist. You're going to find their belt line, come up just a little bit, and then up a little bit more. You're looking for the other point of their sternum. So you were up here, nipple line, okay? Now you're going to come up until you see where their chest, their rib cage opens up, and you're looking for this spot right about here. And you're going to grab them there. You're going to put your fist right up in there, grab with your non-dominant hand, and you are going to pull them up and into you. You're going to bring your fist up and in, and that is going to drive their diaphragm, the muscle that allows your breathing. You're going to drive that diaphragm straight up, okay? And that is going to compress the air in their lungs, which is going to then send it into their airway and hopefully throw the obstruction right out and away from you and them. At that point, they should start to breathe freely. If the first pull doesn't work, do it again and continue this until one of two things happens. Either the obstruction leaves them or they pass out. Once they passed out, they hit the ground, now you're in CPR. And again, I missed a crucial step, same step actually, have someone dial 911. Even if the obstruction clears on that first pull and the paramedics or the EMTs show up, they're just going to do a quick exam, make sure everything's good, and off they go on their way. If, however, the obstruction hasn't cleared and you now have a passed out victim and you're doing CPR, they're already on the way, not starting their journey at the point where you're going to start providing CPR and you have to dial 911 at that point. Just get the EMTs, medical assistance, on the way. All right, so the Heimlich maneuver is the same for adults and children. Infants, it changes. For infants, remember when I said that you'd lay the child out here just to demonstrate where you would line up for CPR, just because I don't have a dummy? That's actually exactly how you're going to line your child up for the Heimlich maneuver on an infant. But you're going to turn them over. So their face is going to be cradled in your hand here. Make sure that their mouth is not obstructed by your hand. And then you're going to provide a back blow that's going to hit the center of their back. So you're looking for basically the same spot as here, but on their back. And so nipple line on the reverse. Back blow there, and you're going to hit forward, down and forward to drive the same mechanism. So their chest is going to compress against your arm, and that's going to then allow the air to blow the obstruction out. And the same thing goes there. If they become completely unresponsive, then you're going to go to call 911, chest compressions. Okay. So that's your the big scary one, which is you have to do CPR. And the most common major emergency, which is a choking or an obstruction in the airway. Everything else past that is going to be something that involves blood. Right? So they have fallen down and done something bigger than simply skin their knee. Right? So skin knee, you're going to provide, you're going to clean out the wound, and then you're going to provide a bandage. If they're squirting blood, we have changed the scenario completely. You are dialing 911 or having someone else dial 911, and then you are going to provide compression on that bleeding spot. Pressure. All right. Grab whatever you've got available. We'll deal with cleanliness later. We're talking about a large volume of blood coming out. We need to get that stopped. So you're going to pack that wound area and provide direct pressure on it. Pretty much doesn't matter where it is. That's what you're going to do, is provide direct pressure. Now, once you've got that pressure on, don't let it up. Not until medical personnel have arrived. Again, you're just keeping them stable, allowing for medical personnel to arrive to actually take over and work the scene and get everything else squared away and get them transported to a hospital. Okay. The key is to remain calm, and that's where the training classes and the certification come in. You do the training, and then you have a built-in muscle memory of response, and you're not thinking at that point, therefore not scared. You're just providing care. You're doing what's necessary to get them to that next step. Okay? So again, get certified. It's really important. Classes don't take a lot of time, but it is something that you want to renew and get refreshed periodically. So blood issues, they come up. It's a matter of direct pressure and then get them to medical care. Another one that comes up with our kids fairly often is that they get something in their eye, sand, sawdust, Lord knows, they get all sorts of different things in there. And you want to flush that out. The key there is that you're going to flush from the center of the eye out. They're going to kick, scream, yell. You just got to hold them, get them underneath a faucet or a sprayer and cold water, and get that up so that it's hitting their eye and blowing it out and away. Okay, so center of eye, outbound. And the reason for that is you don't want to go outer eye. If you've got them so that it's going to drain, you don't want it to drain from here and go across and hit the other eye. So you want to go from center of eye out. So if it's this eye, the right hand eye, you're going to put them in the water so that it's hitting, so that their head sinks here, so that their head is here, and you're going to run the water this way. I have personally had to hold my kid, bodily hold them, while my wife was able to get the water running correctly onto their eye. And there was a time when I had to hold them, brace them against the countertop, hold their head, and get the water to run. It's not pleasant for anybody involved, but it is necessary to get whatever is in the eye out. At that point, once it's clear, it's going to be irritated. It's going to be uncomfortable. But the object is out, and therefore can't be doing any more damage. So we're just, as parents, we have to be the parent and remain calm and not yell at our kid at that point, because that just escalates the situation. Just fix the problem. The problem at that point is that there's something in the eye that needs to be removed. Do that. And then once that's clear, the kid's going to calm down. Your older children may cuss you out because it's not pleasant, but hey, they can still see. Right? And then get them proper medical care at that point. Let's see, what else? Something in the eye, abrasions. You're a parent, you've dealt with abrasions, so that's fairly easy. You clean it out with water first, soap, and then hydrogen peroxide or something along those lines if necessary, and bandage it up. And then a nice Band-Aid so that the kid feels good. In all these scenarios, just try to stay calm, because it helps your kids stay calm, de-escalate them, and get them the care that they need for that problem. The problem isn't that your kid is screaming. The problem is that they have some type of an injury. So let's address the injury, and then we can deal with the emotional part of how they got the injury in the first place, because they were being dumb or just being a kid, right? Either one. They're just being a kid and they got injured. Let's address the injury. After that's taken care of, then we can address how they got the injury in the first place. And again, that goes back to training and being able to separate the individual that you're working with, the patient, deal with them as a patient, and separate that from being your child or someone close to you's child that you know their entire history, and you know they've done this 18 times before, granted, but we still need to deal with this injury this time. Okay. Again, with CPR, this is not an issue, right? Because it's such a big thing. The smaller stuff, it helps if you can keep it calm. Again, find yourself a good CPR first aid class. There are multiple agencies out there. The two biggest here in the United States are the Red Cross and the American Heart Association. Both of them provide good courses, good training. There are also others, though, that also provide good courses and good training. Find one. There are even online ones for right now during the pandemic, so that you can take that class online. It'd be something like this, only with the actual mannequins and everything, and they go through it step by step. They can get you the information that you need in your head so that you have more than just this overview's worth of information to go with, and then find yourself an in-person training as well. That can help. As a refresher, the online is perfectly good. It brings you up to date on what the changes are to protocol. But to truly get it, it's a hands-on thing. So get the best that you can for where you are now, and then move forward from there. But I recommend getting an in-person training experience, especially for your first certification. Well, thank you very much for spending time with me. Again, this is just an overview, and I really hope that you've gotten something out of it. And there'll be more coming for things that happen with our children, and what to do or what you can do. Again, I'm not a medical professional. I'm a former firefighter, and this is just overview material. Get yourself certified. Get the CPR First Aid certification. Take the classes. Have a good one.